Hello, I'm student nurse Bernice, and I'm going to talk about below the knee amputation, which acronym is BKA. BKA, below knee amputation. Below the knee amputation is a surgery to remove your leg below the knee. Your doctor removes the leg and keep as much healthy skin, blood vessels, and nerve tissue as possible. There are nearly 2 million people living with limb loss in the United States. Among those living with limb loss, the main causes are vascular diseases, which include diabetes and peripheral arterial disease. And another cause is trauma. And the last cause is cancer. Cancer accounts for 2%. Trauma accounts for 45%. And vascular diseases account for 54%. Below the knee amputation may be needed if one, you have a serious infection in your limb. The second one is if your limb has been affected by gangrene, which is usually as a result of peripheral arterial disease. And the third one is if there is a serious trauma which has affected your limb, such as a blast wound or a crash. And the last one is if your limb has been deformed and has minimal movement and function. These are the reasons why you may be referred to have an amputated limb. During the assessment before your surgery, your healthcare providers are going to perform a thorough examination on you. This includes your physical health, your nutritional status, your bowel and bladder function, and they are also going to check your cardiovascular and respiratory system. They are also going to check the function and condition of the healthy limb. This is because removing one limb is going to cause a strain on the other limb, so they would have to check the condition and the function of the healthy limb. Another important thing your healthcare providers are going to do is to do the psychological assessment. This will help them determine how well you'll be able to cope with the psychological and emotional impact of amputation, and whether you will need an additional support. They're also going to assess your home, your work, and your environment to see whether you will need an additional support. So these are the vital assessments your healthcare providers are going to assess before the surgery. Before the surgery, the patients must not forget to talk to their doctor about how to manage the factors that can increase the risk for complications, such as smoking, drinking, and some chronic diseases like diabetes or obesity. Also, the patients must tell their doctor about the medication they are taking, being it a herbal supplement or aspirin or any other medication they are taking. This is because it might interact with the anesthesia during the surgery. So the patient must tell the doctor about all these. Do not eat anything at midnight a day before your surgery unless you are told to do otherwise. Follow the instructions exactly about when not to eat and drink. If your doctor tells you to drink medication on the day of your surgery, take it with only a sip of water. Also, take shower before you come to the surgery room. After taking shower, do not apply any lotion or any deodorant. Do not also apply any nail polish. Another thing is, do not shave the sides by yourself. When you come to the surgery room, the nurses are going to do that. Also, before you come, if you have any contact lenses, you have to remove them, and you have to remove all your jewelries before you come for the surgery. Among the surgical team are the circulating nurse and the scrub nurse. The scrub nurse prepares the operating room for the patient, setting up the tools and making sure the field is sterile. The scrub nurse assists the surgical team by donning the surgical masks, the surgical gloves, and the surgical gown, as well as he or she is the one who assists in giving or passing the surgical instrument to the surgeon. The circulating nurse is responsible for coordinating care, obtaining supplies, and also liaising with the patient's family. When the patient arrives in the operation room, it's a scrub nurse duty to cross-check the wristband details to confirm whether the details on the wristband matches the details in the patient's record books. Also, it is the scrub nurse responsibility to check the vital signs of the patient and record and report all the abnormal findings. It's also the scrub nurse responsibility to obtain consent. She must be sure that there is consent already, and she must also make sure that the patient understands the procedure and is ready to carry on. She must also take note of all allergies of the patient. She must ensure that all documents are available, documents including the consent form and also the test results. Another thing is the scrub nurse must make sure that the patient took shower before coming to the surgery room. Also, the patient's medication should be reviewed and given. The necessary one should be given to him or her. And the hair at the operation site must be removed or clipped by the scrub nurse. When the patient is on the surgical bed, the scrub nurse will set a line for intravenous fluids. The scrub nurse will also insert a urinary catheter on the patient. Another thing is the scrub nurse will prepare and drape the patient supine with a bump placed under ipsilateral hip to internally rotate the operative extremity such that the knee and ankle are vertically oriented. So this is the work of the scrub nurse prior to the surgery. Another thing is a tie tourniquet may be placed in a non-sterile fashion as high as possible above the knee to prepare and expose as much of the extremity as possible. So these are the work of the scrub nurse prior to the surgery. For the anesthesia, which will be used for the surgery, it could be regional, it could be general, and it could also be spinal. Sometimes too, they use the local anesthesia. And the local anesthesia, which is commonly used, according to my research, is bupivacaine. Those are the anesthesia which will be used for the surgery. A standard orthopedic operative set is essential. Also valuable to this operation is a tourniquet, suction drain, oscillating bone saw. Right after your surgery, you will be sent to the recovery room where your blood pressure, your pulse rate, your respiratory rate, and your temperature will be monitored. Also, you will be given oxygen through masks and fluid through a drip for the first few days while you recover on the ward. Recovery may also include pain medications, antibiotics to prevent infection, also medications to prevent blood clots. Physical therapy often starts within 24 hours after the surgery. During this time, you may need devices to help you walk. Whilst in the recovery room, the post-anesthesia care unit nurse cares for the patient who is still under the influence of anesthesia. So they monitor your vital signs, level of consciousness, and assure that you can safely be awake from the anesthesia. One thing they use to evaluate the patient is the Adret score. The Adret score accounts for your consciousness, mobility, breathing, circulation, tegument color, and oxygen saturation. So this is what the nurse is going to use to assess the patient. After the surgery, when the patients return home, they will continue with physical therapy and exercise. They will also be instructed on how to care for the limb, and medications will be prescribed to manage their pain. Adjusting to an amputation may be difficult and can lead to depression, so they will be advised to consider seeing their therapist or psychologist. Thank you for watching my video.